All right, so we're going to go over what are ACE scores, how prevalent in the general population are adverse childhood experiences, how do they impact health, and then really, this is a very heavy topic, and it's very easy to say, oh, a child with 4 adverse childhood experience points on the 10-point score. Oh, this is terrible. There's nothing we can do. In fact, I want to leave this conversation. I want to leave everybody who's involved in the conversation with get rid of that, with tools for helping children, for helping adults who have high ACE scores, and mostly for helping themselves to move through the experiences that they've had. There's a lot that we can do. ACE scores are not your destiny. Then for those of us in the healing arts, the importance of screening, I cannot state this enough. We're going to go through a screening during this conversation, and they're readily available online. It's very easy to build screening of ACEs into your practice, whether you're a therapist, whether you're a family practice or pediatrician, whether you're a nurse. It's one of the most important missing pieces in the screenings that we do every day in healing work. But then mostly I'd like to focus on how do we foster resilience in people who either are going through adverse childhood experiences, a child whose parents are divorcing, a child, one of whose parents may have been incarcerated. And then how do we foster resilience in ourselves as adults when you factor in kind of the process that we go through in recognizing what happened to us as children and how that's affecting our relationships and our happiness and the way we move through life now. And then, as I said, I'd like to really have a discussion at the end of the talk. I do have to give a trigger warning here. The things we're talking about are really troubling. They're the worst things that can happen to children. A parent gets taken away, a child gets put in foster care, physical, emotional, or sexual abuse. These are triggering topics. We don't go into details on any of them, but part of this conversation is going to be checking in and taking your own ACE score. And so if there's a point during this conversation where you feel triggered or overwhelmed, please raise your hand. We can pause the conversation. We can ground. We can take some deep breaths. We can recenter. Or if you need to step away, I am happy to talk to anybody about things that come up in this conversation offline after the conversation. And I really do invite you to give me feedback if you'd like to talk about some of the things that come up today. In addition, if you have any wisdom or feedback about the language that I'm using to talk about these topics, I'm absolutely open to improving this talk so that it's easier in the future for people who are attending. Okay, so jumping into it, the Adverse Childhood Experience Study was a collaboration between the Centers for Disease Control and Kaiser Permanente down in California. It was published in 1998, and it was the largest study of its kind. The two lead authors were Robert Anda from the CDC, and Vincent Felitti from Kaiser Permanente. Prior to this, people knew that childhood trauma was associated with things like PTSD, adult depression, but the breadth and the depth of the impact of adverse childhood experiences on lifelong health and well-being, mesothelioma, certain kinds of cancer, immune dysfunction, allergy. The list of impacts that adverse childhood experiences have on adult health was not well described before this. There were over 17,000 participants in the study, mostly middle income, and that is, one of the complaints about this study is that everybody who was in this study had Kaiser insurance, which meant that the numbers were probably skewed toward less prevalence of ACE scores because there wasn't the same socioeconomic cohort. There wasn't the range of people. There weren't homeless people. There weren't people on state insurance. And so really the fact that the numbers and the profound impact of ACEs came out of a study that was almost entirely Kaiser patients is pretty significant. I think that adds validity in a way to the findings as opposed to taking away validity. Subsequent studies have looked at different populations and found very similar data. The focus of this study was to analyze the relationship between childhood trauma and the risk for physical and mental illness in adulthood. Over the course of a decade, the results demonstrated a strong graded relationship. By graded relationship, it means that you have this much increased likelihood of morbidity or mortality for one, and then it goes up with each subsequent adverse childhood experience that you experienced prior to the age of 18. So the study came out in 1998, and then I graduated from medical school in 2001, and I graduated from pediatric residency in 2004. And at no point in medical school, residency, or any training that I got was I ever taught about adverse childhood experiences and their effect on health. This is such a profound oversight in medical training that it really is hard to overestimate. It's hard to underestimate the impact of ACEs on health, and the fact that nobody was talking about it probably for a decade, maybe a decade and a quarter. Really until this wonderful physician, Nadine Burke-Harris, who was working at a clinic in Oakland, California, and she gave a TED Talk, kind of at the height of the TED Talks popularity. You can watch it. It's one of the most highly watched TED Talks in the history of TED. And it made a profound difference because people were suddenly talking about this study that had kind of sat on the shelf despite its profound findings for over a decade. Nadine Burke-Harris later went on to be the first Surgeon General of the state of California. Primarily, this was Gavin Newsom hired her to be the Surgeon General specifically so that she could try to shift the medical model in California over to a trauma-informed care model. And through some efforts that she made, I and a group of physicians in Humboldt County began annual ACE screenings for all children in the county. And since coming to Orcas Island, we've started that program here, and I hope that it'll spread here. She wrote a book kind of going into deeper detail about her findings about the Kaiser study called The Deepest Well. Fantastic book. If you're interested in this subject, I cannot recommend it highly enough. ACE scores are basically, they fall into three categories. This is a very blunt tool, and there's a lot that is left out. Childhood homelessness was left out of the initial 10 questions. Foster care was left out of the 10 questions. Parental death was left out of the 10 questions. It really was just kind of 10 things that they decided to ask about, which is a deficit of the study. Since then, we've expanded the things that we ask about, but I kind of find it profound that just with these 10 questions that leave out so many other things, there's such a graded predictive value for this tool for the physical and mental and spiritual effects of adverse childhood experiences that I just find this study fascinating. So the three areas are abuse, either physical, emotional, or sexual, neglect, and that's either physical or emotional neglect. And then the third category kind of comes under household challenges. That's a parent or the primary caregiver with mental health challenges themselves, intimate partner violence, meaning witnessed violence between the way the question is asked, father abusive to the mother, parental separation or divorce, incarceration of one parent at any point from birth till 18 years. I always expand that, especially with some of my patients who are working in this country but don't have visas. Incarceration, or I also expand it to include deportation. And then substance misuse or dependence in a parent. So these are the 10 areas that they ask about. Now, if you wouldn't mind, I'm not going to ask anybody to share what their ACE score is, but if you haven't done an ACE score, we're just going to go through the 10 questions. This is the original Kaiser question. In our clinic, we do the PEARLS question, which also includes environmental risks, such as violence in the neighborhood, poverty, foster care, things that are outside of the original 10 questions. So just as I read through these, a yes is a 1, a no is a 0, and you'll find your number at the end of these 10 questions. So prior to your 18th birthday, this is from birth to 18. There is some conversation about we should really be thinking conception to 18, because a mother who has a significant mental health event during pregnancy will affect the fetus. But for the purpose of the study, birth to 18, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you feel afraid that you might be physically hurt? Question 2, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Question 4, did you often or very often feel that no one in your family loved or thought you were important, loved you or thought you were important or special, or that your family didn't look out for each other, feel close to each other, or support each other? Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or that your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Question 6, were your parents ever separated or divorced? Question 7, was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Question 8, did you live with anyone who is a problem drinker or alcoholic or who used street drugs? Question 9, was a household member depressed or mentally ill, or did a household member attempt suicide? With this one, I always also like to ask about postpartum depression in the mother. And then question 10, did a household member go to prison or get deported between birth and 18. So I'd like to just take a moment, take a deep breath. These are hard things to talk about, and I just asked all of you to possibly relive some very painful memories. So all right, so that number is your ACE score. I personally am a 3. And that is that came as a surprise to me when I first went through this, because I think that I didn't think very much about some of the things that happened in my childhood. So going through the process of finding your number and really coming to recognize what are some of the things that challenged me as a child and that I potentially had to learn to cope with at a very early age. These are very common. You can see the numbers are not insignificant for yeses in the general population to each of these questions. When you look at the answers this is from the ACE study from 1998, republished in 2016 through the CDC. About a third of people, bless them, none of those questions elicited a yes. About 40% of the people in the survey had one or two adverse childhood experiences. And even one childhood experience, if it's traumatic enough, it doesn't in any way diminish the trauma. But then about 1 in 5, about 21% of the 22% of the people questioned had 3 or 4 or more adverse childhood experiences. Since I've been doing the surveys, what I find is that there's a lot of people who have 9 or 8, right? Chaos begets chaos. So if there are problems in the family, very often the ACEs tend to compound, which is why it's so important to identify positive ACEs early, because you can prevent further trauma to the child by intervening very directly with the family early. So this graph basically shows that in the general population, these events are fairly common. If we have 12 or 14 people on this call, I don't know how many people are on it, 1 or 2 have an ACE score of 4 or above, and about 2 out of 3 of us have at least one ACE. That's the general population. When you look at the prison population, and when you look at populations like people suffering with depression, people who have attempted suicide, you notice very, very high numbers. The entire green area of this graph, 78% of the people have 4 or more ACEs who wind up in prison. This really changes the way I think about the prison population, right? Because for every prisoner, 8 out of 10 of them have essentially deeply troubling childhood trauma histories. And they didn't get the help they needed, which is why they did antisocial things that wound them up incarcerated. There are some amazing programs in the country, and if you're interested in this kind of work, there are some incredible people going into the prisons and doing trauma work with prisoners. I don't know if you're interested in the causality between hardcore addiction, heroin, cocaine, crack, meth. and trauma. The best book that I've seen on this is Gabor Mate's In the Realm of Hungry Ghosts. He's an addiction physician up in Vancouver who works with the homeless and the addicted population in that community. All right. So I don't want to spend too long on this. When a child is experiencing trauma, a number of things physiologically happen. One, they live in fear. Generally speaking, the people who are harming the child live in the house with the child. And when you live in a constant state of fear, when you have uneven or unpredictable parenting, you live with a heightened cortisol level. Prolonged stress has an effect on every system in the body. It affects immune function. It affects neurodevelopment. It affects stress hormone levels. It affects brain development. Severe trauma limits the development of the corpus callosum in the brain. So the two halves, the two hemispheres of the brain can't communicate as well. The consequences of this for lifelong health, cardiovascular disease, cancer, heart attack, blood pressure, stroke, diabetes, weight gain, especially abdominal fat. If you've ever known somebody who had to take steroids as part of a cancer regimen, they get very large. Essentially, what we're doing is we're setting up the body's endocrine system to chronically be releasing cortisol into the blood. Chronic fatigue, reduced growth hormone levels, so kids don't always grow as well. Compromised immune function. When I see a kid coming in every month with ear infections, on my list of differentials is how much stress is this child in at home. Socially, behaviorally, mental health, these children are at profoundly increased risk of unhealthy behaviors. They're at extremely high risk of violence, both committing and being victims of, and re-victimization. Increased likelihood of diseases from cancer to heart disease to mental health challenges. Increased likelihood of disability and early death. Breakthroughs in our understanding of neurobiology demonstrate that fear-based childhoods disrupt neurodevelopment and can actually alter normal brain structure and function, to the point that you can take a child who did not get the help they needed. Again, ACEs are not destiny, but you can take a child who had a very traumatic childhood, and you can put them in a functional MRI, and you can identify areas of under arousal and over arousal, right? Predictably, you would think the limbic system, the amygdala, is over aroused, is overactive in an individual who has survived childhood trauma. Why? Because they had to upregulate that neurologic response to threat so that they could get out of threat. These are healthy, helpful coping mechanisms that are now negatively affecting the individual once they're out of that danger, out of that dangerous childhood home. And the effect is cumulative. So a single event is different than chronic experiences of abuse or neglect. We're about to go into the kind of downstream effects. If you took your ACE quiz, and I'm throwing up slides that say, you're much more likely to have alcoholism. This is only the first half of the story. We're just looking at the study results, and we're just looking at what the trends are, right? It's a risk factor, but it isn't your destiny. You can see that alcoholism is many, many times more prevalent in people with ACE scores of 4 or above than people without adverse childhood experiences. So we talk a lot about alcohol as an inherited disease. Okay, my father's an alcoholic and I became an alcoholic. Does that mean that it's genetic? There's a genetic component to it for sure, but you grew up in a house where one of the parents was drunk much of the time. That affects you. That makes it more likely that those adverse childhood experiences will make you more prone to unhealthy coping mechanisms in adulthood. Smoking as an adult, childhood experiences, and depression. The percent of people with lifetime depression, and I don't have a slide on anxiety, I might, depression and anxiety especially. If you have an ACE score of 4 or above, you have a nearly 60% chance of lifetime depression, which means that if you had a difficult childhood and you haven't had a depressive episode, good idea to start with therapy now so that when these things come up, you have the tools in place to put healthy coping mechanisms into place. If you have 5 or more ACEs, you're nearly 100% likely to be prescribed or recommended prescriptions. Oh, actually, that's per person years, so you're still far more likely. This is the area that, as a pediatrician, I worry about, high-risk teen behaviors. And you can see that for children who experience high adverse childhood experiences, early sexual activity, teen pregnancy, both in boys and girls, teen paternity and teen pregnancy is much higher. This slide breaks my heart. I took it out of the slideshow and put it back in. Sexual assault is always 100% the fault of the assailant. End of period, end of conversation. But the high-risk behaviors that often stem from high adverse childhood experiences as a child put the individual at higher risk for re-traumatization. Again, this is not destiny. This is a trend, and this is something that says, because of what I went through, I'm at higher risk of putting myself in dangerous situations. I am going to take that information and come up with healthy coping mechanisms and healthy strategies to keep myself safe. All right. This is another kind of upsetting slide. People who are victims of childhood abuse and neglect are much more likely to victimize other people when they hit adulthood. And again, unhealthy coping mechanisms. Again, the people who are in prison are there because 8 times out of 10, they had these horrible experiences as children, and they didn't get the help they needed to come up with trauma-informed, healthy coping mechanisms that would prevent them from falling into a pattern of re-traumatization. Okay, suicide attempts. We are currently experiencing a very concerning, very sharp increase in suicides and suicide attempts. And again, there is a significant graded relationship between ACE scores and your likelihood of attempting suicide or completing suicide as an adult. To the point where if you have an ACE score of 4 or above, you're 20 times more likely to attempt suicide during your life. And finally, I threw just in a slide that this is adjusted for drinking and other high-risk activities. Simply having ACE scores gives you a higher chance of any number of physical ailments in adulthood. And these could be cancer, these could be things unrelated to mental health that are probably related to decreased immune function secondary to chronic cortisol levels in the blood. If you have an ACE score of 6 or above, on average, and this again is before therapy, this again is just raw data, right? You can do things to down-regulate your autonomic nervous system in a way that doesn't create this outcome. 20 years lower than that of the US general population. 20 years off your life expectancy. And yet, I have never been to a physician's office where I wasn't asked about tobacco history, about drinking, about any number of high-risk activities, and yet I've never been to a physician's office where somebody asked me what my ACE score is. And yet, an ACE score of 6 or above is more profoundly predictive of early mortality than smoking cigarettes. Okay, I'm glad to have gotten through that part because that is really the bad news. No more bad news here. Now I'd like to shift and talk about the two things that I really want to leave this conversation with, which is how do we prevent adverse childhood experiences, and what do we do for the kids, and what do we do for ourselves when we're coming out of these kind of situations. So this is from the CDC Violence Prevention database. It's a good general strategy. The bottom line is, and this is for everybody who's in the healing field, whether you're a therapist, a primary care physician, when we address children who are experiencing adverse childhood experiences, we have to address the family. There is no treating a child without treating the family. As a society, we can strengthen economic supports to families. We can strengthen financial security, and in work environments, we can create family-friendly work policies, allowing for the primary caregiver in many situations to have time off to spend with the children, creating an environment where family comes first and work understands that. We can promote social norms that protect against violence and adversity. Laws to reduce corporal punishment, public education programs, bystander approaches, and we can enlist men and boys as allies. I think this is a big shift in the last 5 to 10 years, is starting to talk to the boys about what safe and healthy relationships look like. Ensuring a strong start for children, early childhood home visitation. Those programs have solid evidence for helping to strengthen families, high quality childcare available to everybody in every community, and preschool enrichment with family engagement. Connecting youth to caring adults and activities, mentoring programs and after school programs. Sorry, I skipped teaching skills, social emotional learning, safe dating and healthy relationships skills program, and parenting skills and family relationship approaches. Connect your families that are struggling. Connect the high ACE score families with social workers, with family counseling. Here on Orcus, it's Compass Health. Connect the families to the services that they need. Cass, is my dog barking outside my door coming through in the sound?
Nope, can't hear it at all.
Okay, good. Just the neighbors. So this is what I want to leave everybody on this call with. Caring adults and activities. Having a caring adult in a child's life. It can be a teacher, it can be a camp counselor, it can be a pastor or a religious leader, it can be a coach, it can be an uncle, it can be an aunt, it can be a grandmother. It doesn't matter. It can be a neighbor, okay? Mentoring programs are great, after school programs are great, but we all have the opportunity. Just take a moment and think about the family that you know that's struggling. How can you help be a solid anchor every week for this child? How can you help the family to even just taking the kids for an evening so that your mother and father can just take a moment and walk down on the beach together? This is something that we can all do. The isolation, a lot of the mental health impact that we noticed over COVID was from social isolation. We can all do this for the people in our community. We do want to lessen immediate and long-term harms, enhancing primary care, screening in primary care, victim-centered services, and therapy. All right, running low on time. I've been talking too much. Raising awareness of ACEs can help, so thank you everybody who's here and learning about this. I want to talk a little bit about how we build resilience. The opposite of adverse childhood experiences is resilience. Resilience means the child's own ability to bounce back from negative experiences, from negative interactions. And it is what allows a child to withstand trauma. Child has their own biological and developmental characteristics that make them more or less prone to the negative after effects of trauma. But external influences from family, community, and support systems cannot be overstated. Reach out to the families that are struggling. I'll take Johnny for an afternoon and or can I help you with groceries? Can I help you with something in your environment that is going to lessen the stress in the household? Adverse childhood experiences are only half of the equation. They are not your destiny. A 2017 ACEs and Resilience study by the National Health Service in England found that supportive friends, opportunities to engage with community, people to look up to, and other sources of resilience in childhood more than halved the current mental health in adults with 4 or more ACEs and reduced the rate of suicidal thoughts and self-harming from 39% to 19%. Just that, engaging with community, people that they can look up to, and other sources of resilience in childhood makes a profound difference for the entire lifetime of the child. I don't want to go through this whole list again like we did with the ACE study, but you can look up the resilience questionnaire, or Cass, would you mind putting a link to this slide in the comments, and then you can go through this. It's essentially, was somebody looking out for me? Did teachers, coaches, or ministers take an interest in me, and were they there to help me? Could I find somebody I trusted to talk to? This is the antidote. A hug is the antidote to fear. And that, I sound so woo-woo and cliched when I say that. It makes a profound difference, and there is ample evidence to back up that claim. Okay, self-care. I like this is a great model, right? You need essentially 6 things for resilience. You need good food, enough good sleep, you need physical activity, getting out, right? So often these kids are in their room, hiding, coping on their device, not getting out, not getting into nature, not using their body. Supportive relationships, mental health care when it's indicated, access to nature. I am a big believer in nature deficit disorder in this country right now, and getting out into nature, even just getting on the front lawn and having full spectrum sunlight on your face in the morning, 10 minutes, makes a profound difference. It actually elevates your serotonin level for the rest of the day. And then mindfulness practices, I cannot stress enough. In my teenagers, I get them all in my office to download a mindfulness app. All right, 3 guiding principles from a study at Tufts. Positive and negative factors that impact child health exist in all domains. Thus, the interplay among individual, relational, community, and societal factors must be addressed in order to achieve optimal child health outcomes. The answer does not come within the home that created the trauma in the first place. It comes within a community that supports both the parents and the child in that situation. Parent and child health are inextricably linked. You want to help a child who's experiencing trauma and the mother or father is experiencing addiction, help the parent and you help the child. And we always have to remember when we're talking about traumatized children, physical, cognitive, social, emotional outcomes, all of them, and I would add to this, spiritual. You have to be treating the family as a spiritual, energetic unit and addressing all of that. I'm running short on time, so just negative experiences, positive supports. Always try to balance. Identify the families in your life, in your practice, in your family who are struggling, and start building those positive supports. I have this up on my wall. Frederick Douglass said, "It is easier to build strong children than to repair broken men." All love and respect to Frederick Douglass. I would add, it's also possible to repair broken men and women and people. It just takes a little more work.